So I'm Scott Teeples. I'm the Oregon FCE president, and I'd like to welcome everybody here. I hope we have a few more come in. Um, I have Susan from Tennessee and Loretta from Oregon, and I have Jane from Nebraska and Linda from Oregon and Judy from
Maybe
Kentucky
I'll move it over. Can you bring it forward?
And Bonnie is from Oregon, and
Thank you, thank you.
our presenter today is Dr. Tonya Hartig, and I'm going to turn the time over to her. And I'm sure she'll have, if you got any questions, you can just go ahead and ask her, and I'll go ahead and highlight or spotlight her. And if you have any technical problem, Tanya, I always tell people we're all amateurs here.
Okay, no worries.
All right, it's all yours.
All right. Well, I want to say welcome to everyone that's here. I love speaking to groups and really sharing my passion for health with a broad audience. And when we get into the slideshow, I'll tell you a little bit more about me and my background. But I'm excited that you're here to learn about something that I'm particularly passionate about, which is helping people to prevent and reverse type 2 diabetes. So at the end of the presentation, we'll open it up for Q&A for people who have questions, but I'll go through the presentation first. So I'm going to go ahead and share my screen with you.
And we can see
And
it.
okay, great. All right, so we're going to be talking about conquering diabetes, really focusing on type 2 diabetes because type 1 and type 2 are two different animals altogether. But this is a functional medicine approach to optimal health. So, first of all, let me just say right from the beginning, I am not your primary care physician or your endocrinologist. And so just remember that all of the information that you get here is for educational purposes only, and consult your personal physician about changes in diet, exercise, and supplementation before you implement it. So the things that we talk about really aren't intended to diagnose, treat, cure, or prevent disease, just to give you information that you can implement into your own lives if they're a good fit to help get better health results. So, let me tell you a little bit about myself. I have 30 years of experience in preventative health. So, I started out with a degree in education and an emphasis in pre med sciences. Then, I got a nutrition degree, then a personal training certification, then a wellness educator certification, and then my latest degree is a doctorate in functional medicine. And so, my passion really for my entire adult life has been helping people to live healthier lives. And my favorite thing to do is to research health challenges, to research anything related to health and prevention. I really enjoy the research aspect and the teaching and education aspect a whole lot. My husband and I together have 8 children. He has 5 biological children, and I have 3 biological children. The youngest two still live with us. And then we also have a grand pup that is living with us. We have 1 year old grandson. He just turned a year old, and then we have another one due in June. And we love to travel and particularly find bookstores and quaint little coffee shops wherever we're traveling. It's really a fun hobby thing that we love to do. And we really enjoy hiking. So, Scott, I would bet we would both enjoy hiking that mountain that you've hiked. So, for the next 35 minutes or so, you might want to grab a notebook and a pen to jot down a few notes. I'm glad this will be recorded, though, so that you can go back and review it later if you want to. But here's what we're going to talk about today. First of all, I want you to understand how diabetes develops. It's really important. So, if we don't understand how something develops, it's hard to understand how to correct it. And then really understanding the early warning signs of glucose dysregulation, because it all starts with glucose dysregulation. If that's a term that you're not very familiar with, we'll talk about that in a moment. And I want to make sure that you know which lab tests are really essential to accurately determine your risk for diabetes and the complications associated with diabetes. And then I'll give you a few effective strategies that are evidence-based for optimal glucose regulation. And at the end, like I said, we'll do a Q&A. But first, let's start with what is functional medicine, because this is a term that I'm finding a lot of people are unfamiliar with. You can see in the word functional, there is the word function. That kind of gives you a key as to what functional medicine is all about. But let me break it down for you a little bit. So, traditional medicine, these are the things that are like primary care physicians and specialists. So, that's kind of what we consider traditional medicine. And then we have functional medicine. We need both. We need both traditional medicine and functional medicine in order to tackle the the aspects of health in the United States that are making us sick. We need both approach, but let's talk about how those approaches differ. So first of all, traditional medicine, this is your primary care physicians and your specialists, their approach to health is a diagnosing managing approach. So this is what medical schools train primary care physicians and specialists to do, to be able to diagnose disease and to know what medication surgeries, treatments will effectively manage the disease diagnosis. Patient care is really disease centered. So patients are grouped according to disease and they're sent to specialists according to disease. And then they're treated with a standard of care based on whatever their diagnosis is. The treatment approach generally involves medications, surgeries, that type of thing. And it's less proactive on prevention. So, really, your primary care physician, your specialist, isn't really well schooled on telling you how to prevent something, but they've been expertly trained on how to deal with it once you get it. From a collaboration standpoint, it's like referral based and hierarchical. So your primary care physician kind of is the oversight of all of it. And then when you have like type 2 diabetes, you may go to an endocrinologist, but you might also be seeing a cardiologist and a podiatrist and several other specialists, a nephrologist related to type 2 diabetes. And typically those are very segmented from one another and not really interactive and cohesive with one another. And then from a time and volume standpoint, traditional medicine is, a little bit of time with a lot of patients. So doctors see a lot of patients in a day and they spend, very little amount of time with them. We have for my son who has a seizure disorder, we see a neurologist a couple of times a year for him, and he is an excellent neurologist. We get about 5 to 7 minutes with him. He is very efficient and is great at what he does, and he sees a lot of patients about every 7 minutes. So that's kind of your traditional approach to healthcare. But functional medicine is different. So functional medicine really is looking at root causes. It wants to know, why do you have type 2 diabetes? Not just that you have it and how do we manage it, but why do you have it? It's patient centered. So we're not really focusing so much on a particular diagnosis, but we're really looking at the patient and saying, what does this individual person need to do to have more optimal health? Because we're all biologically very different. And the strategies that work for one person to optimize their health would be very different than the strategies that would work for another person. It also uses a treatment approach that's combination and lifestyle based. So, for example, I spend a lot of time with the people that I am working with, helping them to understand, dietary modifications, lifestyle modifications, exercise principles that will help them get the health goals to reach the health goals that they want to reach. Some functional medicine doctors are very integrative, meaning that they are prescribing physicians also. I am non prescribing, but some integrative physicians are prescribing also. So they might use a combination of drug therapy with lifestyle modification to achieve the goals. And I work with a lot of physicians locally and refer out when a lifestyle approach that needs to be combined with traditional therapy is warranted. Um, the focus with functional medicine is highly proactive on prevention. That is really what we focus on. We're not at all diagnosing disease. We're not managing disease. We're actually giving individuals kind of a roadmap for how to live a healthier life. I hear people tell me all the time, my doctor said to eat better, but he didn't tell me what that means. And so that's kind of the area that I really help people with is being able to know how to do what the doctor is telling you to do and to do it well. From a collaborative standpoint, it's very collaborative with functional medicine. So I have a really great relationship with several primary care physicians and specialists in the area. And I refer people to them often, and they refer people to me as well. From a time and volume standpoint, I spend a lot of time with a few people. So I never have more than 10 appointments in a single day, and rarely even that many, because usually the appointments that I have with people take an hour to 2 hours because we're really focusing in on what needs to happen to change lifestyle. So if I had to sum it up into one word, I would say that traditional medicine focuses on the what. What are your symptoms? What disease does that correlate with? And then what intervention do we need to do to manage your symptoms? Where functional medicine asks more the question, why? Why do you have type 2 diabetes? Why do you have high blood pressure? And the interventions that we can put into place that are just lifestyle changes that may complement the medicines you're taking and make them more effective, or may hopefully allow you to stop taking those medications like Scott has experienced, or to not start taking them in the first place. So, of course, these are just generalities, and both traditional medicine and functional medicine has some broad variety within that, but that kind of gives you an idea of the difference between the two if you're unfamiliar with what functional medicine is. So let's look at a reality check in the US, because this is where it really comes to light how sick as a population we are, and that we need to make lifestyle changes to change that. So, about 60% of the adults in the US have at least one chronic condition, and 42% have multiple chronic conditions. And that's according to the CDC. Nearly 70% of Americans take at least one prescription drug, and more than half take two or more. Um, Interestingly, the average 55-year-old and older takes anywhere from 5 to 15 medications a day. So, a lot of medication use in the US. There are about 30 million people in the US that have been diagnosed with diabetes. And most of those, are adults. But we also have a growing number of Americans under the age of 20 that are being diagnosed with diabetes. So the problem is getting younger and younger. It used to be that type 2 diabetes was something that was diagnosed to people who were, midlife and older. And now we're seeing younger and younger people being diagnosed with type 2 diabetes. In 2021, there were about 97 million Americans 18 years and older that had been diagnosed with prediabetes as well. So, this is a huge problem and a growing problem in the US, not just type 2 diabetes, but the incidence of prediabetes when they're just really knocking on the door of type 2 diabetes. And it's also estimated that over 8 million people in the United States have undiagnosed and unaware prediabetes. So, there, in addition to the ones that know they have prediabetes, there are another 8 million who are undiagnosed up to this point. About 88% of Western populations, not just the US, but all Western populations, have some degree of insulin resistance and metabolic dysfunction. And if you're unaware of what that is, I'll be explaining that more in a few minutes. So I wonder where you are on this spectrum and why you are here joining this presentation. Maybe you're just a gatherer of information and you want to learn more about the condition. You're curious about all of the parameters that set people up for type 2 diabetes. Maybe you're focused on prevention, or maybe you have a diagnosis or have had a diagnosis, and you really want direction, because it can be confusing to navigate the information that's out there and to know what is the correct information for you. So let's look at where you might be on this spectrum. We see on the far left of the screen healthy glucose regulation. So, type 2 diabetes is all about our body's ability to regulate glucose, and glucose comes from the foods that we eat, largely the sugars and the carbohydrates that we eat, not just sugar. And our body also makes its own glucose every single day from the liver in a process called gluconeogenesis, where it converts into stored proteins and carbohydrates into sugar as our body needs it. So if you were to not have any carbohydrates or any sugar at all in your diet, your body would still produce what you need in order to function well. So then things happen, mostly dietary related, and we can move into poor glucose regulation. So, in poor glucose regulation, our body's ability to navigate the amount of glucose in our system gets dysregulated and it doesn't function well. And then we move into insulin resistance. And insulin resistance is always the precursor to prediabetes. And prediabetes is just knocking on the door of type 2 diabetes. And this is where you start to see really symptoms crop up. So typically, we don't see a lot of symptoms with insulin resistance when you just get to the insulin resistant part, except maybe for weight gain. But when you move into prediabetes on the way to type 2 diabetes, what we see is a lot of inflammation, chronic pain and nerve damage, blood clots are possible, heart attacks become more likely, loss of vision, risk of amputation, risk of dialysis. The effects of type 2 diabetes are life altering to say the least. When type 2 diabetes is unmanaged for long enough, it dramatically raises the risk of dementia and cancer. Alzheimer's is often called type 3 diabetes in my world because there is a huge correlation between um, unmanaged blood glucose levels and the risk of developing Alzheimer's. As a matter of fact, I think the statistic is 65% more likely to develop Alzheimer's if you have poor glucose management. So let's understand the differences in reference ranges because this is a really important distinction that I feel like everyone needs to know. So what you're looking at is the standard reference range. So when you get your blood work done and they do a fasting blood glucose level, you'll see they'll have a standard reference range. And this just means the standard reference range for all of your lab work is really about diagnosing disease. It's not really about do you feel your best because every one of us has probably been to the doctor and said, I don't feel great. And the doctor has looked at the labs and said, your labs are good. Like, I don't see anything wrong with your labs. But that doesn't fix the fact that you don't feel well. And that's because our standard reference ranges for lab work is those reference ranges are really based on diagnosing disease. They're not about like narrowing the range to really focus on preventing the symptoms that then end up manifesting in disease. So for standard blood glucose levels, the standard reference range of normal is anything less than 100 milligrams per deciliter. So, we can logically look at that and go, okay, well, if it's zero, it's probably not good. So we know that that's too broad of a range to begin with. But then pre-diabetes is like 100 to 125 milligrams per deciliter on your labs, and you would get diagnosed with type 2 diabetes if it's over 126 for fasting. This is fasting blood glucose levels. And there are some other, if A1C is elevated quite a bit, then you might get diagnosed with type 2 diabetes, even if your fasting glucose is a little bit lower than the 126. But let's look at functional medicine reference ranges for blood glucose management. So you can see that the functional medicine range is actually much more narrow. Optimal blood glucose levels are 75 to 85 milligrams per deciliter in the functional medicine range. And then anything on the outskirts of that, from a functional medicine standpoint, we're monitoring it. So 86 to 90, still very good blood glucose control, but we want to make sure it's not creeping up above that fasting glucose above 90. And then we know that you're at risk for developing diabetes when we start looking at numbers that are 91 to 100 in your fasting blood glucose. And then anything that's 100 to 125 is considered very urgent in the functional medicine world. We want to make sure we're making lifestyle modifications to correct that quickly. And then, of course, anything under 125 would be considered disease in the functional medicine world also. So, what are some of the health outcomes of glucose dysregulation? So, we really want to focus on where type 2 diabetes starts, not on type 2 diabetes. So, type 2 diabetes always starts with glucose dysregulation. It's very different than type 1 diabetes, which can start from other causes, virus, born with it, autoimmune, all kinds of things. That's not what we're talking about. We're talking entirely about type 2 diabetes here, which always begins with glucose dysregulation. So, what are some of the health outcomes? Of glucose dysregulation? Well, of course, it's type 2 diabetes, and then cardiovascular disease like heart attack and stroke, hypertension, kidney disease, nerve damage. So that's neuropathy, tingling in the feet, toes, the hands. That's why sometimes people with severe neuropathy end up having amputations. Retinopathy, so that's eye damage from the elevated glucose levels, an increased risk of certain types of cancers, cognitive decline and dementia, non-alcoholic fatty liver disease. As a matter of fact, too much sugar in the diet is the number one reason for non-alcoholic fatty liver disease. Erectile dysfunction, gum disease, depression and anxiety, impaired immune function, sleep apnea, and an increased risk of bone fractures. These are just a few of the potential health outcomes of glucose dysregulation. Now, when I connect glucose dysregulation to Alzheimer's, some people are like, wait, what? And they're really curious about that. So just think about how a PET scan works. This is the way that we're really connecting glucose dysregulation to cancer and cancer cells and Alzheimer's. So we can use a PET scan to look at the brain and see what's going on in the brain or other parts of the body as well. But a PET scan is typically what's used to look for cancer in the body. And the way that it works is a small amount of radioactive glucose, sugar, is injected into a vein. And then the scanner takes a picture of where glucose is being used. So a PET scan can detect and stage most cancers even before they're evident through other tests because cancer cells show up brighter in the picture because they use more glucose than normal tissues. So basically, in layman's terms, what that means is that this radioactive sugar works because cancer cells quickly gobble up all of the sugar because they like it. And that's why a PET scan works the way that it does. So we know that sugar doesn't necessarily cause cancer. It's not just one simple thing that causes cancer, but it certainly doesn't help to prevent or manage the disease well. And then the same thing for Alzheimer's. The risk of developing Alzheimer's disease with people among people with diabetes is about 65% higher than those without type 2 diabetes. And according to the American Diabetes Association, aside from just age, having diabetes or prediabetes is the second biggest risk factor for Alzheimer's disease. So let's look again at where you are. Are you at a place of healthy glucose regulation? Are you somewhere closer to insulin resistance or pre-diabetes? Wherever you are, you can start making changes now to start moving back in the opposite direction toward healthy glucose regulation. And it's important to note that even if you're not at a place where you think you have insulin resistance or poor glucose regulation, 88% of the population, the Western population, is insulin resistant. And it takes years to go from poor glucose regulation to chronic disease. So we want to make sure that wherever we are on this progression, we start making changes now to reverse course so that we're moving back towards healthy glucose regulation. And however far we get on that spectrum, if you're at chronic disease and you move all the way back to insulin resistance, your health is significantly better. If you're able to move back to the place of just having poor glucose regulation, your health is significantly better. So, whatever proactive steps you take, you're definitely going to improve your health in the process. So, let's talk about some of the symptoms of poor glucose regulation because people say all the time to me, well, how do I know if my glucose is poorly regulated if I don't have any tests done? Are there ways to tell without having tests done? So, let's just take a minute and you can score yourself. There are 18 variables on this slide. And I wonder how many of them do you have? You can just make a little tick mark on your page or, keep track of it some way. Do you experience routine fatigue and exhaustion? Do you wake up feeling tired? Do you need a nap later in the day? Are you tired before you go to bed, like several hours before you go to bed? Do you have increased thirst or a frequent urination? Maybe sometimes your vision is blurry and you feel like your wounds are slow to heal or you get frequent infections. Do you have unexplained weight loss or weight gain, increased appetite, wake up feeling tired, have depression and anxiety, agitation, irritation, headaches, crave sweets, have difficulty losing weight, have mood swings, dizziness or lightheadedness, brain fog, difficulty concentrating, tingling sensations in the hands or feet, feeling shaky or jittery, especially if you've waited too long to eat, and then skin changes. So, like skin tags or dark patches of skin, they're called melasma. Um, the dark patches of skin that can happen on your face or on your body anywhere, those are associated with poorly controlled glucose as well. So I'm curious as to how many of you have several of these symptoms happening. That gives you a good idea. The more you have, the more glucose dysregulation you are likely to have. So I want you to know that these symptoms are not normal, not at any age, not at any stage. And also remember that symptoms often precede changes in blood work. So you can have symptoms for a long time before anything ever shows up and your blood work is being abnormal. So you want to address it when you have the symptoms, not when your blood work shows there's a problem. And let me just reiterate the fact that these symptoms aren't normal. And so often we like to say, well, I'm just getting old, or it's just a normal part of aging, but it's actually not. Um, I I function in a realm where there are people in their 80s, late 80s, who are still doing everything that they want to do in life, and there's absolutely nothing physical that impedes them from doing it. And so we don't want to accept the fact that aging means disease because it doesn't have to. We need to recognize symptoms as a sign of dysregulation and start making changes then. Now, I do want to make sure that I point out here as I'm giving you information, don't stop taking any medications prescribed by your physician. You want to make lifestyle changes and then let your doctor help you wean off medications as your body no longer needs them. Before we started the recording, Scott was saying how he was able to, his doctor was able to take him off of all of his diabetes medications because of his lifestyle changes that he made. But that is a conversation for you and your doctor, not for you to play around with yourself. But I do want you to monitor your glucose numbers carefully as you make changes to your diet so that you don't end up in a situation where your glucose is falling too low, or at least your glucose is normalizing, but then you're taking medication that is causing it to fall too low. And the only way your doctor can be confident in adjusting your medication is for you to keep track of what your blood glucose numbers are doing. So let's talk about testing. What are some important biomarkers that will help you to know how well you're doing in the glucose regulation department? Well, the very first one is A1C. This is a blood test that measures the average blood sugar levels over the past 3 months, about 60 to 90 days, actually. Why 60 to 90 days? Because A1C is measuring the percentage of your red blood cells that are sugar coated, basically, is a simple way to put it. And the average red blood cell lives between 60 and 90 days. And so when the red blood cell gets sugar coated, the sugars, the glucose will stick to the outside of the red blood cell like Velcro. And when that happens, it never comes off. You have to wait for that blood cell to die and be replaced before that is no longer glycated. That's the term for that. So really think of it, you want to think of it like the difference between Cheerios and Fruit Loops. You want your red blood cells to be far more like Cheerios, not sugar coated, and much less like Fruit Loops, which are sugar coated. So A1C really shows you the percentage of red blood cells that has glucose attached to it. And the higher that percentage, the higher your blood sugar levels have been over the previous 60 to 90 days. And it really helps to diagnose and monitor diabetes. And a lower A1C percentage is generally better for managing the condition. So it's really important. Now, a lot of times A1C is not included in standard labs. And so you want to just ask your doctor to do an add on, even if it's an out of pocket expense. It's not a very expensive test to have done. So even if you don't think you have any reason to have concerns about having type 2 diabetes, I recommend that at least once a year you have your A1C tested so that you're sure it's not creeping up because a fasting glucose will not catch it. It will take several years of elevated glucose before your fasting glucose really shows up as being problematic. And if you just did an A1C test, you'd actually see a better average, and know, like, are you at greater risk of developing type 2 diabetes or not? So this is just a mock-up, an illustration of what happens with the red blood cells with the sugar coating. Just if you can imagine sugar cubes getting stuck to the outside of your red blood cells and it not going away, this is kind of the scenario that happens with glycated red blood cells or sugar-coated red blood cells. And this is very damaging to the body. This is why type 2 diabetes carries with it a higher risk for heart attack and stroke because as these sugar coated red blood cells travel through your bloodstream, it's causing inflammation and damage inside your arteries and veins. And that inflammation and damage leads to plaque buildup in the arteries and increases the risk for cardiovascular disease, stroke, hypertension, and that sort of thing. So then another one is glucose, of course. Glucose is a type of sugar that our body's cells can use for energy, but we don't actually have to have it to use for energy. We can function completely well on ketones, but just know that it's a form of energy. Our bodies are kind of like a hybrid vehicle. They can produce energy from ketones, which come from fats, or they can produce energy from glucose, which comes from carbohydrates and sugars. But sugar is a very inferior way to get your energy. So glucose measures the amount of sugar in your blood at that moment. It's like a snapshot. And so higher low levels of glucose can indicate certain medical conditions such as diabetes, and the higher it is, the more likely that you have type 2 diabetes. Fasting glucose is important. So glucose is a measure of the amount of glucose in the blood. You can do a postprandial measurement. You're just testing like an hour or 2 hours after a meal. But fasting glucose is really the biomarker that we look for to see how well your body is managing glucose. Like when you go to the doctor, they're going to probably ask you to fast before your labs. And one of the reasons is so they can get an accurate measure of what your blood glucose is doing without any food in your body. So, fasting glucose is a lab test that measures the amount of sugar in your blood after not eating for a certain period of time, usually and preferably overnight. Normal fasting glucose levels for someone without diabetes, optimal levels would be between 70 and 95 milligrams per deciliter. But if the fasting blood glucose level is between 100 and 125, it usually means that a person is pre-diabetic. And like I said, 126 milligrams per deciliter or higher, it usually means a person has type 2 diabetes. Another test that isn't routinely done but is very helpful is C-reactive protein, particularly a high sensitivity C-reactive protein, because C-reactive protein is a marker of inflammation in the body. It is C-reactive protein is produced by the liver in response to inflammation. And studies show that elevated levels of CRP are associated with an increased risk of developing type 2 diabetes. It can be influenced by a lot of different factors: obesity, hypertension, stress. So we want to have the C reactive protein levels checked because it's going to give us a better picture of inflammation in the body. And chronic inflammation in the body is a driver of type 2 diabetes. The next one is triglyceride to HDL ratio. So most people know about triglycerides and having triglycerides tested, but it's really the ratio specifically of triglycerides to HDL that gives us a better indication of the likelihood of metabolic syndrome. So that's when you take your triglyceride number and you divide it by whatever your HDL cholesterol score is. And that helps to assess the risk of developing type 2 diabetes. So when that ratio is high, it suggests metabolic syndrome, cardiovascular disease, insulin resistance, and diabetes. So if you don't know what metabolic syndrome is, it's actually a cluster of conditions: hypertension, obesity. It doesn't always have to include obesity, but hypertension, um, glucose dysregulation. So you got elevated glucose levels and some other metabolic factors, higher lipids, and that sort of thing. So we want to make sure that we're looking at this ratio, which isn't usually, this ratio is usually not done on labs, but you can do it yourself. If you have your blood lipids checked, you can make that, you can divide those two numbers and figure out what your ratio is yourself. So here's an important point to note, and this is one of the most significant things people can understand. Whatever your fasting glucose levels is, when you get that to a normalized level, that's great. But also really important is what happens when you consume food. Do you have a big spike in blood glucose and therefore a big spike in insulin? And that's important for people who are trying to lose weight because insulin is the fat storage hormone. So your body produces insulin in response to elevated glucose because it's trying to get the glucose into the cell, which I'll show you in a second. And the higher the insulin goes, the more you are going to store food as fat. Even healthy food will be stored as fat because insulin triggers storage. So you might start out with a healthy fasting blood glucose level, but then if you eat something that is high in sugar or high in carbs or just not properly balanced, and your blood glucose level spikes 30 points or more above your baseline. So let's just say that your fasting glucose is 90, which is great. And then you eat a meal and you test your blood glucose level 1 hour after your meal. As long as if 90 is your baseline As long as your blood glucose levels did not go above 120, you're within a healthy range. But if that meal caused your blood glucose level to go more than 30 points above your baseline, then that meal was not a well-balanced meal for you and caused too much of an insulin spike and a blood glucose spike. So that's a really great way to monitor if what you're eating is helping you to reverse your type 2 diabetes is if you just test 1 hour after a meal. That gives you a really good indication of was that meal good for my glucose management or was it not? That's just a helpful tip for those of you who are checking your blood glucose levels. So here we see glucose, or those little circles floating in toward the large cell. And the little flower-like object, that's insulin. So glucose cannot get into the cell on its own. It has to have insulin in order to get into the cell. So insulin gets released, comes along, connects with a receptor on the cell, like a key in a lock, opens a door, and the glucose goes in. And then the glucose gets carried to the tissue that it needs to go to produce energy. Just know that the more glucose you consume, the more insulin your body needs in order to regulate that glucose. So it's not just the glucose regulation. The amount of sugar that you consume can overwhelm your body's ability to produce insulin to regulate it. When that happens, insulin resistance takes play. So you can see these glucose molecules coming in, trying to get into the cell, but they just bounce right back off because there's no insulin to open the door to the cell to allow the glucose in. And this is where the A1C starts to go up because it can't get into the cell, so it just sticks to the outside of the cell. Our body is so intricately designed that it knows how to prioritize and balance every single process. So it's helpful to know that all dysregulation begins as an attempt to regulate. So insulin resistance is actually a protective feature if we know how to correct it. But when we don't know how to correct it and it keeps happening, then it actually can cause harm to our body. So if you're having any of those symptoms that we talked about earlier, just know that your body's really trying to protect you with symptoms. It means that it's like lights on a dashboard. So it's trying to give you information, hey, something needs attention before it fully breaks. So you're not broken. Your body's just trying to protect you when you're having symptoms. Your body really is your friend trying to protect you. And if we just know a few key things about how to love our body back, then it will respond well. Those few simple, consistent changes over time can have a really huge impact. So, what are the three main factors that play a big role in our ability to manage glucose levels? Well, first is what we eat. So, it's not just that we eat low carb, it's literally like, are you eating foods that are helping to manage your glucose levels well? That means that you're using fiber and protein to help stabilize your blood sugar levels, and fat, healthy fats will do that as well. So when you eat, let's say, a baked potato, even a baked sweet potato, people consider baked sweet potatoes as healthy. So let's just say when you eat a baked sweet potato, and let's say you eat it completely by itself. And if you do that, your blood sugar levels is likely to get quite high from that, even though it's considered a healthy food. But if you instead have that baked sweet potato along with a grilled chicken breast or even a steak, and you eat the meat first, then you eat the sweet potato, it's your glucose numbers won't spike as high because you've had something else that slows down the digestion of those glucose fibers into sugar, and your glucose levels are more managed. So it's what you eat. Then it's also when you eat, both time and frequency. So, what we know is that glucose numbers are better managed when you don't eat too late. So, you cut off eating a couple of hours at least before you go to bed. And also the number of times you eat. So, that if you eat more frequently, if you eat 5 meals a day, you're going to be producing insulin 5 times a day. And that is not the best thing for glucose management if you have insulin resistance. So, if you can narrow down the time that you eat, uh, intermittent fasting is good. I don't prescribe to a particular like specific window of intermittent fasting, but just we shouldn't be eating 14 hours a day, right? So if we can like eat in an 8 or even a 10 or 12-hour window, it's much better than if we spread it out over time. And then if we eat in only 3 meals instead of eating snacks throughout the day, that is far better for glucose management than eating small meals. And then how much we eat, even if it's considered healthy. If we're overeating at a meal, even if it's considered healthy, it can cause our body to have to produce more insulin to deal with elevated glucose levels. So it's not just what we eat, but when we eat and how much we eat that play a role in how well we manage our blood glucose levels. But then there are also three main lifestyle factors that influence glucose levels. And the first one is stress. I know because I've tested it on myself. I've checked it with others that I'm working with. We test glucose levels under stress or when there's been a night that there's been a not as productive sleep. And fasting glucose levels are always more elevated under stress and when you didn't have a good night's sleep. So if you're like, I don't understand why my glucose level is elevated because I'm eating really well, do examine what you're eating and make sure you're eating in good parameters, but also take a look at stress and poor sleep as potential for causing glucose dysregulation issues. The second one is exercise. We know for certain that exercise helps to reduce blood glucose levels. You can test this yourself. If you're trying to manage your glucose levels, you eat your evening meal and you test your glucose levels an hour later. And then the next night, you eat your evening meal and try to eat the exact same thing, and then go for a walk right after your meal and test your glucose levels an hour later. You will see that if you will just be active for 15 minutes after a meal, it will drive your glucose levels down because your muscles will gobble up that glucose and use it for energy, and it will lower your glucose levels. And so, just not sitting down immediately after a meal has a big impact, even if it means you're just moving around your house, doing some housework or laundry or whatever that might be. Just don't sit right after a meal. Give yourself about 10 to 15 minutes of activity after a meal. And then the third one is nutrient deficiencies. So clinical studies are pretty clear. There are certain nutrients that when we are deficient in them, we don't manage our blood glucose levels as well as we could. So, some things you can do to monitor your health outcomes. The first one is test. It is really the number one thing that you can do to prevent type 2 diabetes and to reverse it is to know your numbers. You can't master what you don't measure. So, I always say test, don't guess. Get a glucometer. You don't need a prescription. They're not very expensive. You can start testing at regular intervals in order to make sure that you are getting your glucose numbers into a healthy range. And if you test and your glucose numbers are in a healthy range, I would recommend testing once a month. Just pick a random couple of days, test several times throughout the day, once a month, and make sure that you're continuing to maintain that healthy state. Now, the information that I'm about to share with you, some of it is about supplementation. And I want to make sure that I share with you that supplementation, in my view, is intended to support overall health and to supply the body with critical nutrients needed for proper functioning. Supplementation is not to manage a disease, to prevent or cure a disease, to treat a disease. It really is to support the body so the body can function as well as it should on its own. But don't add supplements without making sure that they're compatible with medications and other things. So the same thing for food is true. Um, I'm going to give you some general strategies, but they may not be right for you, especially if you have kidney disease or some other factors. You would need modifications on these. But first of all, three key food strategies, and these are just general recommendations. First, eat a moderate level of protein, about 30 grams of protein per meal. In some cases, people need more, significantly more. And in some cases, people need less, depending on if they have Parkinson's disease and they're on carbidopa levodopa, like they need less protein. They're not able to consume that much per meal, usually about 20 grams per meal if they're on that medication. And people with advanced kidney disease usually can't have that many grams of protein per meal either. So make sure that you are, if you have any unusual conditions, that you're checking with your physician before you increase your protein. But about 30 grams per meal is ideal. Also, being carb aware. It means not just knowing how many carbs you're eating, but like what those carbs are doing to your body. We all instinctively know that there's a very big difference in 50 carbs of chocolate candy and 50 carbs of sweet potato. There is a difference in how our body reacts to it. So we want to be carb aware and try to keep our net carbs to less than 100 per day. If you don't know what net carbs are if you take the total carb count in a food and you subtract the fiber from it, that gives you net carbs. Fiber helps to slow the release of glucose. That's why we look at net carbs when we're managing type 2 diabetes. And then be aware of, like I said, the carbs that we are consuming to make sure that they're healthy carbs. Fiber, you want at least 20 grams of protein per day, but I will tell you the higher you can get that number, the more well managed your glucose levels will be. And then very low sugar intake. So less than 30 to 40 grams of sugar for the entire day from all sources. And that includes fruit. And I know people like to argue with me on that because they say fruit is healthy, and fruit is healthy, but fruit isn't always healthy for everyone. And a person who's struggling to manage their type 2 diabetes needs to reduce the amount of fruit that they consume because it is a sugar. So stick to berries if you're going to have fruits and cut out the majority of sugar from all other sources. It also doesn't mean switching to artificial sweeteners, but we'll talk about that in a minute. And then when you eat, 3 nutrient-dense meals per day without snacks and stop eating 2 hours before bed. That's really important. And how much you eat, just make sure that your carb, fiber, protein balance is good for you and that you eat in moderation. Eat to the point that you're about 80% full. You're not feeling like, you know, overfull or stuffed, that you're leaving room to be just a little bit not full when you stop eating. That's a good way to put it. 3 things to remove from your diet. This is really important because these foods cause inflammation, and inflammation is a driver of type 2 diabetes. So, seed oils, that's canola, corn oil, vegetable oil, peanut oil. These are not healthy oils at all. The way that they're produced introduces a lot of chemicals to your body, and also they're highly inflammatory. Highly processed grains and other foods. So, all of the fun, yummy things that come in a package and in a box, we need to avoid the majority of those, especially as we're trying to get our glucose numbers under control. And then sugar and artificial sweeteners, both. So, processed white table sugar, but sugar in all forms, even honey and maple syrup, even though they're natural, if you're trying to get your glucose levels down, you have to really limit those as well, and definitely avoid the artificial sweeteners. The most common artificial sweeteners in the US are acesulfame K, or it might say acesulfame potassium. Amino sweet is a new name that's starting to circulate. Aspartame, neotame, saccharin, and sucralose. These are all artificial sweeteners that have negative health consequences, and we want to avoid those. Um, I know sometimes I've had conversations with primary care physicians who don't have a problem with their patients consuming those. I will tell you, there's plenty of research to say these are not a good thing to include, especially for type 2 diabetes. They actually increase cravings for sweets and carbs, and they do not help anyone lose weight. They actually, people who consume large amounts of these, or just even normal amounts, tend to gain weight, not lose weight. So it's important to avoid those. In order to avoid them, you really need to read food labels because you might be surprised where sugar or artificial sweeteners are sneaking in. So let me just say labels change. So don't rely long term. If you read it once, you have to keep reading it every now and then because sometimes companies change formulations of things. You need to be aware of it. And also, the example I'm about to show you have changed now. It's been a couple of months since I looked at it, but let's look at something that would be marketed as healthy. This is the Mission brand protein plant powered tortilla. So it first of all, the packaging looks really healthy, right? It's the blues and the greens. You've got peas on the front. It looks really healthy. We see plant powered, which is, code word for healthy. We see it has high fiber. It only has 3 net carbs, and it is a good source of protein, and it's low calorie, 0 grams of sugar. So this looks like a really excellent food to consume. However, when you flip it over and you look at the label, you see not so much. So, in addition to having the oils that I talked about not consuming, it has vegetable shortening, which has soybean oil in it. It has some additives that really aren't necessary, that are just extra and aren't really good for your health. And then you see sucralose is on the list. So I don't know why we need sugar, particularly artificial sugar, in a tortilla, but it is in the ingredients list, which makes this a food that I would definitely avoid. So let's talk about some lifestyle strategies for glucose management. We've talked about food, so let's talk about stress. reduce the stressors that you can, and then use adaptogens to better support your body. And if you're unfamiliar with adaptogens, they're just some key herbs and nutrients that can help your body function better under stress. Ashwagandha is a really common one. Exercise. Keep moving for at least 15 minutes after meals because muscles use and store glucose for energy. And then add some additional nutritional insurance. Scientific studies show that key deficiencies in key nutrients are linked to the development of type 2 diabetes and poorer outcomes after diagnosis. So, what are those? Vitamin D deficiency has been associated with an increased risk of insulin resistance and type 2 diabetes. You want to make sure that you have adequate levels of vitamin D. And adequate levels are not the standard reference range levels. It's actually 50 to 90 nanograms per deciliter. That is a more adequate level of vitamin D. So you really want to be above 50 on your vitamin D score. Magnesium improves insulin sensitivity. Omega-3 fatty acids help to lower triglyceride levels and reduce the risk of cardiovascular complications in individuals with type 2 diabetes. B vitamin deficiencies impair glucose regulation and increase the risk of developing diabetes. And so here we see a clinical study. Vitamin D deficiency is significantly associated with retinopathy, that's damage to the eyes, in type 2 diabetes. And then fiber. Fiber slows down the absorption of glucose, helping to regulate blood sugar levels better. Then probiotics. That's something that a lot of people might not associate with type 2 diabetes, but there's emerging evidence suggesting that probiotics have a positive impact on glucose regulation in individuals with type 2 diabetes, and they can help improve insulin sensitivity, reduce inflammation, and enhance glycemic control. The little chart that you're seeing on the screen is just a list of specific types of probiotics. Probiotics come in different strains, and there are some that are shown to be more effective in type 2 diabetes management than others. Now, we would like to think that we don't need supplements because we just think, well, I can eat healthier and I can manage my diabetes that way. And while I definitely say you need to be eating healthier, the reality is that in the United States, we don't eat enough fruit and vegetables. A recent CDC study found that 76% of adults don't eat enough fruit and 87% don't eat enough vegetables. So we're really just not eating enough. And even when we do, let's be real, it's not our grandma's veggies. My grandmother picked from the garden and put it on the plate the same day, and that is not what we have. When we measure the nutrient studies, when we do nutrient studies on the foods now, we know that the protein and vitamin and mineral content of our fruits and vegetables have declined, while toxic minerals like aluminum, lead, and cadmium have increased. Not to mention the fact that most of them are genetically modified and have been sprayed with chemicals like pesticides, herbicides, and fungicides. And so it really means that the foods that we eat, even though we think that we're trying to eat healthy, they're not as healthy as they were 50 years ago. And nutrition surveys prove that. In addition to them not being as healthy, they also are higher in sugar. So, because of selective breeding and genetic modification, the majority of the foods that we eat are higher in sugar content. So, apples have a 50% increase in sugar content than what they did about 50 years ago, about 25% more sugar in strawberries, about 30% more sugar in tomatoes than the heirloom varieties, and anywhere from 33 to 56% higher sugar content in carrots than the ones that were previously grown when my grandmother was growing a garden. So, all of this just really means that we need to fill in the gaps in our diet with supplements. So, if you just think about it, like the nutrients that you get through your diet are important, and supplements are never an excuse for a poor diet. We don't just eat what we want and then take some supplements to make up the difference. That's not how that works. We want to have an excellent base diet first, and then fill in the gaps in our diet with at least a multivitamin supplement, or depending on, what our other certain needs are, to fill in the gaps to get more of the nutrients that we need more of, because people are all very individual and different, and some people need more of some vitamins than others. So I like to recommend a multivitamin. This is particularly for people with type 2 diabetes. A multivitamin, a vitamin C, particularly sustained release, a probiotic. It's even better if you add B complex and omega 3s. But what I want to emphasize is it's really important to choose safe, clinically tested, pure supplements. And I want to explain to you why. There are thousands of supplements on the market, and most people know, well, I'll try to find something that I feel like is more natural, and that's great. But does it really matter? Do you really need to be choosy about the supplements that you pick? You absolutely do, because they don't really have to be tested. So this is an x-ray of vitamins that are leaving the body undigested, undissolved. So this is, you see several different vitamins that are like one a day or whatever. They're not necessarily that brand, but just a vitamin that is moving through the digestive tract and they haven't even dissolved. And it's important to understand why. So in 1994, Congress passed legislation known as the DSHEA, the Dietary Supplement Health and Education Act. And DSHEA served a really great purpose. So DSHEA was designed to make sure that you didn't have to have a prescription to get your vitamins. And that was excellent. But what it also meant was that it was the vitamins were classified as food and non-drug. So if you look at the FDA's website, you will see this exact quote. I took it off of their website. The U.S. Food and Drug Administration does not have the authority to review dietary supplement products for safety or effectiveness before they're marketed. So that means that these products come onto the market, and really the burden of proof is on us, the consumer, to make sure that they're both safe and effective if we choose to use them. I personally don't want to be a lab rat, so I've spent about 30 years researching supplement and supplement companies along with other things. And there are a handful of companies whose products I'm really comfortable using personally and with the people that I'm advising. But let me give you some key things to look for. I have about three factors that are criteria, and I want to try to get all three of them in one product or one brand if I can. But these are the three factors that I look for. First of all, there has to be scientific efficacy behind the product. I showed you clinical study excerpts from vitamin D and the importance of vitamin D. So I'm not so much talking about like um, the fad products. Like I want to make sure that there's efficacy for the product itself. So we know the benefits of vitamin C, vitamin E, vitamin D, B complex, like they're proven in scientific studies. So then the second part is, well, let me just say, so that means that I avoid anything that's a fad product. The latest, greatest new supplement on the market, I'm not going to be the one taking it. I'm going to look to see what the benefits are before I jump on that bandwagon. Is there research behind it? Is it tested? Is it safe? So the second key point is published peer-reviewed clinical studies, preferably double-blind clinical studies. Very few supplement companies go to this extreme to do this because it costs money to do it, and they're not required to do it. So what I want to know is not only is there scientific relevance behind, say, vitamin D, but I want to know, has the company done research to prove that their vitamin D product actually gets into my bloodstream to do what it says that it does? I want to know, is there proof that it dissolves and it gets in my system and makes a difference? And then the third one is quality and safety. And this is really important because if you'll remember from a couple of slides back, the FDA doesn't actually have the ability to check supplements for safety before they're put on the market. And so we really want to make sure the quality and safety is there. I look for things that have a lot of clinical research. So the landmark study 1 and 2 is a research study that compared supplement brands and people didn't use supplements at all. It's the longest supplement study that's ever been done on any supplement use. It was over a 10-year period, and then they did a follow-up study to it. So that's the kind of thing that I'm looking for. And in this study, it actually showed that that the supplements made a huge difference. It was like a specific brand of supplements. But the landmark study significantly, this was on a specific brand, showed lower blood sugar levels for people who took this particular supplement, lower medication usage over time. This is significant with the number of people in the US who are on multiple medications. So, long-term use of the right supplements can definitely put you in a better place for your health. And then the last thing is clinical testing. I do not want any kind of pesticides, herbicides, fungicides, heavy metals. I don't want those in my supplements. I'm trying to avoid those in my food. I definitely don't want to be purchasing a supplement for my health and then consuming these things. Unfortunately, when the FDA does spot check supplements, often they find heavy metals. like mercury, lead, and arsenic in the products because these things are in our soils. And so even if it starts out as real food, these could be in the soils and be contaminating the product. And then if they get chemicals sprayed on them, those contaminants can come from those chemicals. So a lot of people know, like, I'll look for an organic product, right? Because organic is better. Except we need to understand with food and with supplements. So this is true for foods and it's true for supplements. Organic is just the means of production. It means that when the tomatoes were being grown, nothing was sprayed on them, nothing was sprayed on the soil. So there weren't chemicals used in the growing process, but it doesn't actually indicate that the end product is free of contaminants because they can be sprayed on the way to the facility to be made into supplements. So beyond organic is really what I want to look for that ensures after harvest that there aren't chemical contaminants on the product. So not all supplement manufacturers go to that length. And I don't have to have 100% of that criteria to use a supplement myself, but I want as many of those criteria as possible. So just wanting to give you some guidelines. I don't make specific recommendations about supplements and supplement companies in a group setting because not all supplements are right for each person. But I do help people on an individual basis know which supplements might be best for them. So let's talk about where you can start. The most important thing is to start now changing something. Just pick one little place and start there. If it's what you eat or when you eat or how much you eat, if it's just like moving your body for about 15 minutes after you eat, that is really important. Or if it's adding some key supplements to your diet every day, do something to help improve your blood glucose levels. And then if you need more help to implement the information that you've heard, or okay, come January, I'm going to take a more serious look at this. I will be hosting a class in January, a group class on Zoom. Registration will open for that November 15th, and that will be specifically on preventing and reversing insulin resistance and type 2 diabetes. So, once again, just remember this wasn't medical information for you specifically. It was general information for you to do your own research because I believe you should be the CEO of your own health and that you should discuss those decisions with your doctor and make decisions that are best for you long term. And thank you so much for having me here today. We'll take a few minutes and I'll do a Q&A. I'm going to stop sharing my screen. And let's see if I can get back to seeing everybody again.
Yeah, we can see you again.
All right, great. I can see everybody again as well. Does anybody have questions for me?
I was diagnosed with diabetes in 2009, but I had a lot of stress in my life from the time I was 25 and a half, and I'm sure that added to it along with some other things.
Mm-hmm. Stress plays a huge role in the development of type 2 diabetes.
And I didn't realize that I couldn't eat all the crackers I wanted. I'm only allowed six little
Mm-hmm.
crackers and my jelly beans.
Mm-hmm. Yeah, so what we eat makes a huge difference in management. And like I said, it's not that we can never have any of things like even just, fruit. It's just food combining is important and then moderation, especially when we're trying to get those numbers down. Being more strict so that we get those numbers down faster means that, we get control faster and then we can find out how much wiggle room we have in our diet on a daily basis.
And I do not take any of their pills for diabetes. Um, I try to do it with food, and I don't always get the most perfect diet, but I'm not dizzy or anything. And so, and I used to have a really good AC1 or A1C, excuse me, I
Mhm.
said it wrong. I don't know what it's running now. I will find out on this 15th of this month.
Mhm.
So,
Yeah, that's wonderful. Monitoring is really important. We can
well, I
get
don't do it
results.
like I should. And I used to be very, very persistent on it. But my stresses went up when I couldn't keep it, close to 100 or below.
Mhm.
And so I stopped monitoring for a while. You know, and I feel like I'm doing all right.
Mhm.
So,
Yeah, it's important to find the right level of monitoring for every person that doesn't stress them out. So, the way that I like to look at all of our monitoring devices, whether that's a scale, a blood pressure cuff, a glucometer, whatever it is, the way that I like to look at it, it's just giving us data. It's giving us data. It's not a measurement of how good we are or how bad we've been. It's just data. And once we have the data, then we can do something to like move that data in the direction that we want it to move. So finding the right, um, like not checking at all is not a good idea, especially if you've had a diagnosis in the past, but finding the right time to check. So whether it's once a week, or it's a couple of times a week, just knowing like, okay, I'm going to test and I'm not going to stress out about what the result is. I'm going to use that information to drive my decisions. If you can kind of wrap your head around that and get your mind to say, it's okay, whatever it is, it will drive my decisions, you'll be a lot better off with that.
well, um, I find that as long as I eat pretty much on time, if I go too long after like a lunch or something, I will start feeling dizzy.
Mhm.
But if I have if I have a cough drop or a piece of candy and I suck on that, then it doesn't usually even happen.
Mhm.
I'm being
Yeah,
dizzy
probably if
anyway.
you included more protein in your meals, you would manage
I
the in
do
between
have
meals better.
I eat probably more fruits and vegetables than most. I mean, sometimes I only have one fruit a day, but I think I probably have more fruit and vegetables than some people do.
Hmm. Yeah, so it's the protein and fiber and healthy fats that play a big role in managing those glucose levels best. So you want to make sure that you have fiber in your meals from some source, even if you have to add some psyllium husk fiber or some other type of fiber into your meal. Do you want to have a healthy source of fat? So, healthy fats are coconut oil, um, grass fed butter, ghee, um, and avocado oil and olive oil. So, those are the healthy fats that you want to have at every meal. You can put MCT oil into drinks. You just don't cook with MCT oil, but that's a really good fat to have. And then, of course, the healthy fats from the foods that you eat that contributes to it. Then you want to make sure you have adequate protein, and those are, good, clean, and lean sources of protein. And if you have fiber, protein, and fat in every meal, it will really go a long way with helping manage glucose levels more. And it will make you feel more full so that you don't need to snack between meals.
I don't normally ever snack between meals.
That's good. That's good.
And I almost, unless it's cooked with some oil in it, I never um, have oily, not even on a salad. I don't have an oil based um, uh, dressing. I
Hmm.
just I seldom ever have butter or any of that. So once in a great while, if I want a baked potato, I will splurge because
Hmm.
I hardly ever eat it.
Hmm. Well, just remember those healthy fats are healthy. We have demonized fats in the US, and I'm going to tell you, when we tried to switch everybody to a low-fat diet back in the 60s and 70s, that's when we start to see the rates of Alzheimer's disease go way up. So a low-fat diet is not a healthy diet. I'll fight you on that point. It's not a healthy diet. So we want to make sure we're getting lots of healthy fats. The key is to make sure that they're healthy fats. They're very nourishing for the brain. Your body loves healthy fats. Your joints love healthy fats. It's really important to include those in our diet. So we don't want to skimp on the fats. We just want them to be healthy and then make sure we're not consuming so much of them that we're getting these really high calorie levels.
Well,
Does
I
anybody else
think
have a question?
So
Go ahead.
Tanya, I just saw a presentation about that very thing on the healthy fats and how we got it upside down actually a little bit on that.
Mhm.
They said go away from all the fats and eat all those carbs. and it caused
And
some
that
problems.
created an explosion of type 2 diabetes and Alzheimer's.
That's exactly what they said. They went right along with what you said. And I just appreciate this. I've taken a full page of notes on this, and I just really like everything you did. I mean, I've gone down that road. You went right down my road of my life, and the tough times and the good times. And I really liked what you said right there, where it says what versus why.
Mm-hmm.
And that was a great way. And I'm just, learning to and I'm actually kind of fortunate now. I did blood strips for years, every morning, every night, and now I have a Dexcon 7, which I'm looking at it right now, and I'm about a 92 as we sit here,
That's
and
awesome.
and it just varies. And I figured out some of this stuff my own hard way. Is not only what you eat. I notice stress. Stress will bring it
Mm-hmm.
up real fast, and some of those things that people think are those really, really good fruits, they're not so good for you. If I drink a cup of orange juice, I got to be prepared because it's going to jump real fast.
Mm-hmm.
And unfortunately, it
Mm-hmm.
goes back down fairly fast. But anyway. So I just got a whole bunch here, and I don't want to spend your time on there. I really appreciate it there. I'm sure some other people got comments or questions.
Let me let everybody know. I'll put it in the chat as well, but my website's currently undergoing a revision, but it's still live. Just I'm going to be updating all of the information on there over the next few weeks. But my website is liveamazing365.com, and I'll put in the chat. And so you can just go, there's a form on there. You can reach out, ask a question or whatever on the forum on the website. So I'll be putting up a lot more information in the coming weeks as well. They'll just give people good information that they can use generally to help make some better lifestyle choices. So keep checking back there because that's going to get some updates that'll really help people a lot over the next few weeks.
The thing that helped me a lot with diet, because I couldn't take the pills, um, is finding out that I have 3 half cups of vegetables a day, 3 half cups of fruit a day, and a 3 to 5 ounce piece of meat a day is, you don't need more than that on, I mean, at a meal time, like a half a cup and so on and so forth. Sometimes I eat it down at the church, and sometimes I'll get a little more of the I want to say starchy stuff like macaroni and rice and stuff because it's whatever Facebook sends in. A lot of times, they'll they serve what is available,
Mm-hmm.
or what people have donated.
Mm-hmm.
So
Well, I've got about 5 minutes left before I need to get to my next appointment. Does anybody else have a last minute question they want to ask?
Well, I was interested in the fact I wonder sometimes when I eat the same things and the next morning my blood sugar is higher or something. It's good to know that could be from lack of sleep or stress. Not not wondering, well, what did I eat? It was the same thing I had yesterday, and so that
Mm-hmm.
was good to know. Thank you for all the information.
You're welcome. That's such a confusing thing when you think I ate exactly the same thing. Why did my body respond differently? But lack of sleep or just interrupted sleep, if you get up one extra time to go to the bathroom, it can really make a difference in your fasting glucose levels the next morning. So it's good to know that so you don't stress out too much about it.
So Tanya, you don't mind if I put, when I on our website on the page there, I'll put the recording on there. You don't mind if I put that liveamazing365.com on there so
Sure,
that
that'd be great.
so they can go to your website. Okay, I'll do that.
I have a quick question, Tanya. I had never heard about monitoring glucose before you were in the pre-diabetic or diabetic range. And so, can you help me? Are there some glucose monitor things that you can get where you don't do the finger stick all the time?
Sure, that's what Scott was talking about earlier. They're called a CGM. Your doctor can write a prescription, but insurance won't pay for it if you're not pre-diabetic, probably. But you can get
Okay.
one without a prescription, you can look at levels.com is a good one. There, if you don't finger stick, they're kind of pricey because you have to change those out, those sensors out every 14 days. But they just go on the back of the arm, and then they Bluetooth to your phone, and you can see a constant reading of what's going on. So Signos is one. Levels is one, and NutriSense is the other one. Signos, I've had some clients on that and they've had a little problem with it. So, but the NutriSense and Levels have been great. They haven't had any issues with those. So I would say Levels is one of the best ones that you can get. But you
Okay.
can just look and compare the different features of them. And like I said, it's an out-of-pocket expense without a prescription, but it's a really important one. Even if you don't have it long term, if you're just wanting to know what are my risks, like where am I, you can just do like 3 months of one, get a good idea of where you are, and then, you know, a year later, do it again, kind of see where you are. 6 months later, do it again. So you don't have to do it constantly. You can just do it intermittently just to get a good idea.
And so if my husband's in the same boat as I am and we both want to do the same thing, we'd have to buy it twice, right? We'd each need our own.
You would.
Okay.
And so finger stick is definitely a whole lot cheaper, but I
Okay.
definitely get that it's difficult to do a bunch of finger sticks every single day. I have some people that don't like doing it, but
Uh-huh.
it's important to be able to know what your risks are and to be able to start reversing it before it becomes a problem.
And for
Um,
the finger stick type, what kind are those?
There are a lot of those you can just get on Amazon or Target, CVS, and Walmart. The One Touch Ultra is a good one that I have a lot of people use. But pretty much you can go on Amazon, look at reviews, and get one that's simple to use, get one that you don't have to constantly use the drops to calibrate it every single time you switch out a new bottle of test strips, and one that will preferably like Bluetooth to your phone so that you can keep a record of what those numbers are. And the monitors themselves are very expensive. The test strips are what get to be expensive if you're testing a whole lot. But you test a lot in the beginning, and then you can, once you see kind of where you are, then you start testing less and less because you get a better idea of how well you are managing your glucose levels.
Okay, thank you
So
very
if
much.
you and your husband got a finger stick kind, you would both use the same monitor and the same test strip. So it'd be
Okay,
significantly more cost effective that way.
and
thank
can
you.
I make a suggestion? Instead of
Sure.
sticking the end of your finger, do the sides of your fingers at various places. So that way it doesn't hurt as bad.
Mhm.
Okay, thank you very much for that tip.
Thank you very much. I know you've got to go on. I appreciate it. And again,
You're
I'll
very
record
welcome.
this and I'll send you the link for it when I get it all uploaded and everything like that. And you can look at it
Perfect.
and
Thank you so
see
much.
if you got any suggestions for it. Thank you very much. I really loved it.
You're very welcome. I hope everyone has a blessed day.
It
Thank
was
You
you.
a
too.
great
Thank you.
lesson. They really need to share this with a lot of people because this is
Mhm.
very, very helpful. You know, I keep learning things.
We should be lifelong learners for sure. Absolutely. Thank you, everyone. Goodbye.
Bye all.
Bye.
I thank you so much.
You're
Bye.
welcome.